Thanks for staying on. We're going straight across. We're connected with Mrs. Kiran Mazumdar Shaw, Biocon Chief with us. Appreciate you, ma'am, being with us. Good evening. Your first reaction along the lines of your expectations of what you've heard in the union budget today?
Well, my first takeaways from the budget were that it was focused on growth, investment and jobs. And I think that is a very good focus for a post-pandemic budget. I think there were no negative surprises, so that sort of buoyed up investor and market sentiments. And I was particularly impressed with the focus on healthcare, which is but natural after the pandemic. And I think what is important for us to understand is that the investment focus on infrastructure projects, mega projects and healthcare to create jobs and to bring back the lost jobs into the economy is extremely urgent. The big challenge we have is how quickly can we get the financial model working? Because I'm very, obviously supportive of the government in its divestments, its monetization and privatization plans, but it's always a worry that it may not happen fast enough. So I think the focus has to be on how quickly we can get the funding organized, because we really need to get into this investment mode very, very rapidly. The other point that I wanted to make was that private sector has to be a very integral part of this budgetary allocation. For instance, research and innovation. There were huge, statements made on how much they were going to invest in the public sector research ecosystem. But I would like to see a strong industry academia focus in this allocation. So, in everything we do, even whether it's divestment and monetization, I think private sector has to play a very important role. And unless private sector is taken as a close partner in all these measures, we will find it very difficult to implement in time.
Right. Mrs. Kiran Mazumdar, this was, of course, very, very specifically also asked to the Finance Minister with respect to the point you raised in the first press conference that she just done earlier this afternoon in ensuring that there is a jobs creation. She stated that this is a cycle which will eventually fall into place and come into place. This is a budget that has incentivized growth. This is a budget that is spending for growth, and that would eventually happen. That shouldn't be a concern being raised for immediate job creation. It's a cycle, and let's wait for the cycle to play out.
Well, unfortunately, we have seen huge job losses. And even though it's a cycle, and I agree with the Finance Minister that it is a cycle, we don't have the luxury of time to wait for that cycle to happen. So we have to almost kickstart it. And that's where I think we need to focus a bit. I think the healthcare sector is a huge opportunity for us to create an immediate job opportunity for millions of jobs. Because, the allied workforce in healthcare is huge, whether it is ASHA workers, Anganwadi workers, nurses, paramedics. You can see that this pandemic actually exposed the vulnerability that we have in delivering healthcare services and healthcare in general. And I think if this is an area we can really focus on, we can create large number of jobs in this sector. I think infrastructure projects is another big job creating sector, and that's why I want these projects to take off as soon as possible. So we do need to focus on how we unleash and unlock value from many of the PSU divestment or monetization or privatization measures that we are planning to take. So I don't think we have the luxury of time to wait for the job cycle to start working. So we need to give it a kickstart. Right.
Okay. Yes. Also, with respect to allocation here that's come in for the health budget, of course, each time the expectation is more, that there should be more, but this is the maximum in decades that we've ever seen, a record 137% increase here in allocation. In your understanding, in your calculation here, as far as within that allocation for the health budget that is coming for COVID vaccine expenditure, it's a one-time expenditure. The criticism now that is coming in, that it is of course 35,000 crore rupees here for COVID vaccine, but it is a one-time expenditure, and this is going to be falling short as well.
Well, the way I look at it is that, look, if we can spend 35,000 crores for COVID vaccines this year, then we should be able to spend 35,000 crores every year for our disease burden, which is a health emergency, if you think about it. We cannot ignore anymore the communicable and non-communicable diseases like TB, diabetes, cardiac, cancer. We have to invest in those as well. So I think it's a good thing that we have decided to spend 35,000 crores on vaccines, but I hope the same 35,000 crores can be rolled over in coming years on these areas as well. Secondly, I think we also have a one-time spend on that 64,000 crores on beefing up the primary, secondary and tertiary care infrastructure. I think this is an amount that needs to keep, being spent on our healthcare system, and especially when we get into the National Digital Health Mission. So I think this extra amount of almost 100,000 crores that we have allocated to healthcare ought to be spent every year, because we have to get up to the 2.5% over the next 4 or 5 years. And if we want to get up to 2.5% by 2024, then we've just got to keep this pace of spending going. So I, for one, believe that this is a signal that we can spend this much, and we should spend this much and more in the coming years.
Right. As an assessment, if you could bring across this assessment from your side very quickly here on, once again, on what has been announced within the health budget here, in your view, and what we've had in the past few years for what had been another landmark announcement in terms of Ayushman Bharat, and what we've heard today under PM's Atmanirbhar Swasthya Bharat Yojana, under which these announcements have come in. How do the two pan together with respect to what has worked so far under Ayushman Bharat vis-a-vis what we are expecting to work today in other areas under this new Yojana?
So I think Ayushman Bharat is a very important and a very great initiative that has been rolled out. I think it has helped a large number of BPL families already. And I think we need to, make sure it's a comprehensive universal healthcare, from preventive, promotive and curative healthcare. So we need to look at all these aspects. Secondly, we need to strengthen our primary health center. We need to primary healthcare structure, and we need to basically make sure that wellness is going to be a big focus. So I think the finance minister has done well in terms of budgetary allocation for all these areas.
Chairperson Biocon, Mrs. Kiran Mazumdar, appreciate you speaking to us. Your first reaction, your first big takeaways for the Union Budget 2021 that has been announced today. With that, we're slipping into a very tiny breather. Stay on with us here, please.